Ms. Roxana, we're about to proceed and start with our full body correction program, especially for the cervical, spine and lumbar. Could you please share what are the reasons you've come here?
It's because I have a very strong pain on my right leg, and even before I had the pain on my back, and it's migrating to the right leg. I cannot walk with, and I cannot stand the pain. And I have tried acupuncture, I have tried physiotherapy, and I have tried a lot of medication. I'm quite tired of this, so I would like to try something that hopefully will make me good.
Inshallah. Here, this is not the first place that you've come to. Initially, you consulted at the hospital, and what was the outcome there?
They gave me a bag of medicine and physiotherapy, and they said to me that eventually I will not need an operation, but the pain it will stay for 1-2 months, and with the medication it will go, and of course physiotherapy. Then parallel with that I have tried acupuncture. Now I have done 3 weeks of physiotherapy, one day acupuncture, cupping, massage, name it, yani all of them. Still the pain is worse than before actually. It's migrating in a worse way. So okay. I really cannot take it anymore.
What has been explained to you regarding the source of this problem, the cause of these problems?
You have told me actually, even the doctor, they have said to me that I have a disc prolapse between L5 and S1, and a disc inflammation between L4 and L5, and this is due because of the last operation that I have done it on February, where they said that while I was in anesthesia, the doctor by mistake moved me, and probably moved me in the wrong way, so it dislocated 2 of my vertebrae.
I see. And since coming here, we've also established in the
cervical side. I didn't feel it in now, probably, I don't know, but as the postures I can feel, and I was always thinking it's because of working so much on the computer and trying to stay in front, maybe of this, maybe because I'm sitting a lot and I'm driving a lot, and probably is that, but till now I didn't feel the pain on the cervical position, it means upper area. It's like just sometimes stiffness, you go out of from massage, it's go, but my lumbar pain is the worst.
The lumbar pain, so we're working on the lumbar and the 2 discs in the cervical.
Yeah.
Inshallah. Could you please share with me the experience on day 2 after day 1?
Yesterday when I left from here, actually, I felt my spine a little bit relieved. So there was not that much pressure. I could drive easily to home. Though I still have the pain on my leg, but not as it used to be. Before it used to be from top to toe. But now I don't have the hip, not the hip, I do have it. How you call this in English?
The thigh?
Yeah, the thigh. That's, I don't feel it. I still have pain, not like before. I feel much more mobility on my back, and there is no more that much pressure, and I can walk better. That's the one thing that it happens. I can walk better. I don't need. By the way, and I don't need painkillers.
Is that something positive for you on day 2 only?
The biggest achievement in day 2. No more painkillers, and that is a good thing.
I want to get some clarity, madam. Could you please explain before where the pain used to run from and to, and where you're not feeling it now?
So it was from the top,
yes,
top, continuously till down on the back, the right side, till the bottom, till here. Continuously. I can, with my mind, I can draw the nerve. Like this, it was exactly continuous. Like this, it will go direct down till the ankle. All right.
And that was continuous.
I do feel here, but I believe it's the muscles mostly. Okay.
Yes.
This part is relieved completely.
Wow.
And this one, it's really stiff, but better than yesterday. Clearly, better than yesterday. Yesterday I couldn't put my leg on it. But this one, it's a big achievement. I don't feel pain anymore.
And how is that different from previous methods or previous treatments that you're having? Have you seen a difference between other...
my back, that's the spine, it's really a big difference. Because before, I told you, I tried acupuncture, I tried physiotherapy. It works for 10-15 minutes after the session. After that, back to square one. So you continuously taking till eventually you will heal, or maybe you will get worse. But for me, 1 month, the same thing. 10 minutes, that's all my physiotherapy work. That's all my acupuncture work. Maybe, let's say I had the condition that I have to drive after acupuncture. Let's say that's why it didn't work, because I really think acupuncture is good, but not that good.
I see.
Means after one session with you, I drive pain-free on my back.
Big difference.
While with that one, no. And I woke up today okay with my back. Yani, I told you, leg, it's there, fine. Half of it, let's say. But back, I didn't have pain. I didn't have pain when I wake up today.
Wow.
So it's a big deal.
How does that feel to not have pain after so long?
Great. Really,
Well, when we're dealing with the disc issue and we're dealing with the lumbosacral area, there's disc pressure, and we're dealing with the cervical area as well. There is nerve irritation, and that can cause issues, and it can be subjective from person to person. You, for example, are a person that, thank God, you've been able to take a very high level of pain. Not always good, because sometimes people fight through it when they don't need to, but you've been somebody who's been taking high level. In your opinion, then, the percentage, it is subjective, but if before you mentioned it was a 7 out of 10 pain, right?
Yeah.
What would you say it was after or at present? Yes.
Today I can set like 5.5. So
Good change.
20% mostly gone.
20%.
Yeah.
Within a very short space of time,
Yeah.
right? Within less than...
Nothing. Yani, come on, we see each other 2 hours, 3 hours maximum in this time. That's it. Yani, come on, it's a big achievement.
And
I don't have that. You didn't understand. The day I sent you message, I was crying. Literally. I'm 42 and I was crying. I reached the level that I couldn't take it anymore. Finish. I was done. That's desperate message to you. I'm not the person to go and check anyone and anything. I just said, I'll try anything. I just want to.
yes.
So
And
I came. Luckily, I can't you.
We spoke, but
Yeah.
was there, in all honesty, and I'm not saying it's over yet, there may be some good days, some bad days, but in all honesty, before we met, what was your apprehension? Were you concerned about anything, or were you just too desperate to care, or what was?
It was a desperation. I want something that I didn't try. I want something that maybe it will improve my condition. And I was speaking with one, she's an Indian lady who's making the physiotherapy for me. So I was telling her, there is anything there that you can give me to sort me out. She said, no, for us we don't have this.
So
While I was reading on
Yes,
your web there, it was written chiropractic, but what would attraction to me, it was laser therapy.
Yes.
So immediately I called my friend and I asked her, do you know anything about laser therapy? She said, actually my physiotherapist said that laser therapy will work much more faster than any other therapy. This is one of the things. Second, it helps healing. It's not just trying to relieve your pain. It helps healing, which is a different story. Physiotherapy, it just relieve your pain. It doesn't heal. Your body will heal. But while laser therapy and chiropractic that you are doing, chirotherapy that you are doing, these two together combined, it will help you heal. That's what triggered my mind. That's why I called you.
Yes. And now that we're here and you're experiencing our customized high intensity laser, which is the most powerful in the world, and we know that you are noticing difference with that?
I told you, my back, it is relieved. Means there is, see how I was said, I want people to understand, I'm the person who carry the pain. I'm not complaining on easy pain. I passed through delivery with no painkiller, no nothing, so I didn't have, even I didn't say, meow. I didn't really, honestly. So I'm the person who carry pain. If I reach here, that pain is unbearable. I cannot take it. So I reach to a level. So for me, talking to you right now and not having that pain, and I'm able to see it and not move. Usually when you have pain, you start moving. You move from one position to another. I don't. So it is a discomfort there, but not to the level to be noticeable, to make me struggle, to make me stress and all the things. I am without pain. I can consider myself without pain completely. My back is okay, like normal daily basis.
What would you like to achieve? What in your mind do you want to achieve? Yes,
Healing.
you've got some pain relief, but what do you really want to achieve?
Healing. I want to heal my back. I don't want this to come again. I don't want to face again this. I want healing. I want to know that every disc in my spinal cord, it will be okay.
Okay, so there's many people that opt, sometimes they're desperate, they opt for like a quick fix. They tried the medication as a quick
No,
fix.
that is physiotherapy, that is medication, that is acupuncture that I have tried. That is a quick fix. Means relieve the pain, then it will still continue, the generating still continue, because I know I'm the person who look into things. I'm not a doctor, but I like to know about my body. I like to know what's happening with me. I like to know about these things. So I know that these things, it's going on and on and on and on. So, all right, let's say I've been neglecting my health in a way that I didn't care about my back. I don't carry things or I didn't take care of myself. But still, I do believe that my body has a power on healing. It doesn't. Without help, it doesn't work. For me, it doesn't work. So I need your help in order to heal, to not have again after 2, 3, 4, 5 years, let's say maybe I make a wrong move and again I will start from square one. No, I want that this to be fixed.
Okay.
Maybe not 100%, but at least to be fixed. Maybe I can make a wrong move, but it will not be that much pain, that much degeneration, that much struggle.
Yes.
You know?
Here's one thing I'll ask you, madam. There are many people, and the vast majority, we know with the medical establishment and we know with advances in surgery, many people will just say, well, this is a surgical case. Well, why don't you go with surgery? What are you, and everybody's different, but what are your reasons for not opting for that?
First, I'm done with my surgeries. As my case, I'm talking personally now. I do already have 10. I'm done. This is one of the things. Second, I still believe that there is an optional. Surgery implies so many things. First, it's the pain that you are having after the surgery. It's a risk. You never know that it will come back, that you will come out okay. Maybe it's a failure. That can be yes or no. And when someone makes a failure on your spinal, it's quite risky. So I don't want. This is 2. Third, recovery after the operation. I've done 10. I tried it. No, thank you. That's no way. And most important, they don't guarantee that it will never happen again. So it can happen again. So why shall I go to this whole process in a heavy way when I can take it natural way? Why shall I take it in complicated way with medicine and poisoning myself and all this? I don't want anymore. I'm done.
Good. Positive so far for you.
Yeah.
Good. Alhamdulillah. Thank you for sharing. On day 3, madam, please tell us your progress.
The progress that I had it actually, and as I told you when I came in, I slept without waking up. So usually I wake up 2 times. I have a very short time of sleeping. I sleep like 5 to 6 hours.
When do you usually go to sleep and when do you wake
11:30, 12, something like that. And usually I wake up at 5:30 maximum. So this time, and I wake up twice a night. Whether I have pain, I have back pain. Even when I didn't have the issue with my disc still, I wake up twice a night because of the back.
So this
I
is
have
usual.
To move.
Twice a night,
Yes.
between, so 11 you go to sleep, by 5 usually you're awake,
Yes.
but within that time, whether even before the onset
Yeah.
of this problem,
Yeah.
you're waking up about
Two
twice
times. Yeah.
twice per night.
Yes.
When you usually wake up, would you be in pain before?
No, I will not feel. I will feel discomfort. I have to move. My back is like stiff. So you know when you stay into position
Yeah.
for a long time, your back is stiff. So I have to wake up and to move, and then
Okay.
I will sleep. So
And-
because I feel like I'm stretched,
Okay.
so I cannot.
And since the onset of this problem, it has actually become painful when you are waking up.
Painful, yeah, I wake up because
Okay.
of pain, and pain will wake me up. Clearly, it's not only the stiffness that I had; it
Okay.
was pain.
So yesterday was day 2, today's the 3rd day. So what happened last night?
I didn't wake up. I don't remember anything. I just slept and I wake up and I just hear the alarm. I said, what? Already? I forget to wake up, I think. It was like, I didn't have the pain. Nothing was disturbing me during the night. So that's a good thing. I don't know what happened. Really, I don't know what happened. I told you when I come, maybe I was too tired. Maybe I don't. Even when I'm tired, and I am usually the person who really goes to the exhaustion, means like I work very hard and I have very little time to sleep. So that's even in that time, I wake up twice. But last night I was dead.
Wow.
Till 5 o'clock, I slept.
Dead in a nice way, right?
Yeah, dead in a nice way.
And have you been given any medication or any
No.
sedative to make you tired?
No.
Or-
I never took sedative in my life. Just if it was prescribed the doctor, but that it was painkiller. But sedative to go to sleep, I never took it. Never. But this time, I told you in day 1, after the day 1, I give up on you saw in my purse when I came, I had the painkiller. I told you before coming to you, I took painkiller because I had pain. But day 2, I stopped it. I said, even if it will be a little bit pain, I'll bear it. I don't want. I hate medicine. That's my option. I wanted to give up. Now I'm okay. I came today with no painkiller, no nothing. So 2 days I'm out of painkillers and everything, and I could sleep.
What effect does that have on your outlook towards getting better? The fact, okay, you still have pain. What percentage would you say you're less now after 2 days? Compared to how it was?
We were 0.5, so we can go to 4.5.
Wow.
Yeah.
So out of 10, huh?
Yeah.
So progressively getting better.
I can feel it. I told you, even my friends, they know me and they were with me this time and they were asking me how are you doing, and they could feel it from my voice. But now they said, you are back? I said, yeah, give me a little bit time, I'll be back. I'm back. I'm a very active person, so they are shocked seeing me not walking, not talking. When you are in pain, you have no mood for anything, not even living. But this time, I'm picking up.
So yeah, there is still a problem. We know there's an ongoing disc issue. We know that. But the fact that you're not taking painkiller, the fact that you've been able to sleep in years now without even waking up, this is something different. What does that tell you, like in sort of like confidence and outlook?
I think this it relieves me from a stress that I used to have and I didn't know. Probably all the time my back was stressed, because what I do different than what I did before, it's and twisting and tricking, and I don't know what you can call this on my back, that it relieves me from stress. I don't have that feeling, on my back. It's like it's free. That's what I felt, and probably that's what let me sleep at night. There is no more stiffness on my back. So I do believe that this is you twisting my back. Really, because I cannot explain exactly what it is, but when you are
working
on my back, the muscles probably they are not any more stiff, and even the spinal itself, it's probably not that much stress to push me to wake me up.
Sure.
So I do feel that this it is.
Great stuff. Well, we know what's happening. It was interesting to hear your perspective on that. So thank you for sharing that.